Welcome to this installment of the Akiro EMR instructional videos Post-Exposure Prophylaxis Akiro EMR Workflow. This video was developed by the Shared Health CSIS team in coordination with the Primary Care Program. This video is meant as reference material regarding the functionality of the EMR. Examples provided during demonstration cover various workflows and should not replace any on-the-job instruction provided by on-site supervisors, managers, or directors.
Fluids exposure form. This is promoted into our EMR under that title. So when you have your first patient come in and they've been seen in emergency, we've received the referral, we've set up the appointment, the patient shows up and the provider needs to walk through making sure all the follow-up pieces are completed. The first section is just looking at some of the results, particularly the HIV results. You'll notice throughout the form it's a little bit color coordinated. Hopefully that makes it a little bit easier to follow, as it is a very complicated protocol. The HIV section is all done in blue. Anytime you have rounded boxes like this, these are indicating that there is a question to answer. So was the patient's HIV screening completed? These boxes are, beside the yes and no, are all markable. So this is how you will document your encounter with the patient. No additional Accuro encounter note is required unless for some reason that isn't following this process and you feel the need to make an additional note. Otherwise, your patient presentation is plan is documented all on this one form. So you'll go through and check off the boxes as required. Any of the hexagon boxes are endpoints or referrals. All blue hexagon boxes are indicate that this is a referral somewhere else. Any of the square boxes are a bit more of your action items and the next steps. All red shaded hexagon boxes indicate that there is no HIV PEP required, but again, there are additional steps that we will need to take, and those are outlined in each of the boxes. So again, rounded, asking a question, you're going to mark your answer, and then you're going to indicate in each of the decision boxes or action boxes how it's applicable. Green hexagon boxes indicate that HIV PEP is required. Of course, there's action items that go along with that. And the hexagon orange boxes are where we land in our protocol that a clinical decision must be made that you're going to consider PEP. And then there's further instructions on what what supports you need in order to help make that decision, such as the seroconversion rate and reviewing those with patients. So you're going to work down your algorithm, answering all the rounded boxes, actioning any of the square ones, and then ending up at your decision point with the hexagons. The second section is the HIV medication counseling section. This has been historically one of the bigger issues for the initial presentation. HIV medication is very expensive, upwards of $1,000 if there isn't any medical coverage. What I'm hearing from teams that have been doing this up until now is often there is additional coverage that they can access, but those processes take some time and need to be started right away. One of the pieces of feedback that Emerge has taken into consideration, and they have within their package the start of these conversations, directing patients either to connect with EIA, connect with FNIB, go to victims' compensation if there is a police report and they have access to victims' compensation. They do have coverage for these medications, or workers' comp as applicable. There also is, I've included in here, if in the event there is no additional coverage for these medications and you want to start the pharmacare process to see if, like, where their deductible would be, how much they would be expected to pay for these medications. There is a bit of a calculator that's been posted. So in the clinic, we can easily look and say, okay, so your medications aren't covered, but due to your income, your pharmacare deductible is $200. Do you have the ability to access that much funding in order to purchase these medications ongoing? And what I'm hearing is most people are able to get the money that's required, but sometimes it does require some time in order to make those arrangements, borrow from family, etc. So that is much of this first conversation on the first visit. The initial follow-up appointment in the community is spent a lot on this, and it is going to be some problem solving. There are going to be scenarios that come up that we've never seen before, so I can't lay out all the options there, but I've tried to include in here as many of the links to some of the supports that we have available to get that ball rolling. There is one backup plan for those who haven't gotten their PEP medication, haven't been able to arrange the funding for their PEP medication, is a second 3-day starter pack that we are able to bridge. Manitoba Health is very clear that we are not to give more than 2 starter packs, so they get 1 starter pack in emergency, and they can get a second starter pack in community if required, because they haven't gotten their funding lined up. But after that second starter pack, the direction at the Manitoba Health level is that's it. That's all they're willing to support. That's where we need to reach out to some of our community partners, including like a partner pharmacy of the patient's choice, to explore if there's other options that the pharmacist can help support with as well, such as the pharmacist supporting them completing their application to pharmacare. Once we move on, continuing down at the end of this section, you'll see there's the direction to go on to section 4. Section 4 is your hepatitis follow-up. So we're going to go through here where, again, you're going to answer any of the rounded boxes, action any of the square ones, and make your way down the algorithm to give you guidance on what needs to be done, what other testing needs to happen, or if any immunization or medications are required. Again, your red hexagon boxes are your endpoints, no further action required, and you can move on. Hepatitis B, it is a bit tricky because it divides it up into whether the source is known to be positive or not known to be positive. And then within each of those, there are 3 options based on the exposed risk. So based on whether that exposed patient has had any of the immunizations for hepatitis B. So if they've completed their immunization series, but you don't know what the response is, whether they've mounted immunity, then you follow that pathway. If they've completed their series once, but they have not mounted immunity, you'd follow the second pathway. If they've completed a series twice and still haven't mounted an immunity, you're going to follow this pathway. If they haven't completed the series, they've never done it, or you don't know what their status is with an uncompleted series, you'd follow the 4th pathway. Similarly, we have those same 4 options. If the source's status is unknown, and we have 4 additional pathways there. Finally, similarly, we're going to go through the same process for hepatitis, looking at their risks for infection, and then your next steps and your decision points. Finally, if the patient has been a victim of a sexual assault, that there was a sexual contact and component to this exposure, then we need to make sure that any of the STBVIs are also followed up with and treated as appropriate, and then also checking for pregnancy and treated as appropriate. I am going to go up. There's a couple of pieces within this form that can at first appear a little complicated and will lead us into our next appendices. So, is the source known? Yes, we know who the source of this exposure was. Then we need to somehow connect that patient with that source. So if the source is known, if they're willing to speak with us, the conversation happens with the exposed. It will be their kind of responsibility to bring that person forward. And then we're going to work on connecting those two charts together. That will be actioned in this box here. You'll see there's a source EMR file number. And that's where we're going to put it in there. In order to put a source's information on this form, which will live only in the exposed electronic record, we must get consent from the source. CSIS has been great at putting together and helping us create a clinical note template to guide that conversation. This was done in conjunction with the legal department as well as privacy to make sure that we are in alignment with all legislation. And although it's not an additional form, it is a clinical note template that you can pull up. So this is the clinical note template. So the first section is just your script highlighting the pieces that you have to discuss with your patient. So someone has identified that they've come in contact with your blood or body fluids. It is your choice to be tested except where there's an order by law. So the link to the legislation is here, as well as a quick summary of who that legislation is applicable to. So victims of crime, anyone providing emergency medical assistance, or your duties as a first responder. A chart will be created at the clinic for the source. The other person will not be told your test results, but they will receive treatment based on that information. Your name and results will not be documented in the other person's chart, but they will be linked by a confidential chart number. And with all lab testing, they will be part of your provincial record. So then we just have the pick list of whether the source was able to consent, yes, or yes, they are, but they need the assistance of language access, public trustee, whatever the case might be. And then the question of whether they are going to consent to having their blood work and tests completed. If so, we can book that appointment with them at the clinic if they want to come in, or if they would prefer, we can't insist that they come to one of our 5 hub sites for that blood work. They can go anywhere. But if they do come in and if they do agree, we also need the bottom question around whether they agreed to having their charts linked using the file number. And then obviously this section on questions and allowing them the opportunity to ask any questions they might have. Within Akiro, once you've created that record for the patient, if they're not already in Akiro, or and they've provided consent, it is this file number. So it's not their FIN, it's not their MHSC, it's this file number that is the one that is their EMR specific file number. So it's a random number assigned, and it's not linked to any other system outside of our EMR that anyone else would have access to. So that is the number put onto the form. That is the number that you put into EMR file number just here. As you go through and work through this algorithm, you'll notice there's boxes that are populated with a date field. This is to help arrange the follow-up appointments. During the appointment, you will have to toggle, like minimize your document and toggle into scheduler to book these follow-up appointments as they come up, and CSIS has some guiding documents on how to do that. But the reason it's important to transfer that information into this document is that will auto-populate the clinical note template for you for all of your follow-up appointments. I would like to go back to the guideline. Appendix C in the guideline is a bit of an instruction follow-up sheet. So a how-to in completing the form, much of the things we've talked about today around the different color, the rounded boxes, the squared boxes, the hexagon boxes, what it means, how to document, checking off the boxes, yes or no in response to each of the questions, how to follow the links that might be found in there, and then section by section. So again, linking the source and the exposed chart is found in the instruction sheet, indicating, pointing to the file numbers so that you are aware of which number we're talking about and putting in there and linking those charts together. The medication counseling piece is what we've spoken about already. The one criteria that we do need to make sure, tips we need to make sure we do when filling out these prescriptions is that we have to write that it meets EDS Schedule 2 criteria in order for it to be covered by any of those options. And I am suggesting that a list of favorites for all the PEP medication based on table 3 and 4 of the Manitoba Health Protocol, the link is in the form, be created by each of the providers so that you can pull those up easily when the time comes, because the regimens are very specific, clearly outlined in the protocol itself, but do require some thought in generating them. So I would suggest generating those prescriptions and keeping them as favorites for those who might come across these so they can easily initiate those prescriptions. Going to the follow-up appointments, one of the big requests of the working group was somehow a summary of all the upcoming appointments, because there are multiple that come out of this encounter. There's be a 1-week appointment, a 4-week appointment, a 12-week appointment, and a 24-week appointment. So what has been suggested is using the F4 function in the EMR, which will print all of the upcoming appointments once you have them booked during the encounter, and providing the patient with that list before they leave, so it's very clear that they know when they're coming back and what they're coming back for. And then one final piece that I'd like to go over is the Akiro follow-up clinical note templates as well. So again, in the patient encounter note section, there will be post-exposure follow-up clinical note templates. So the week 1 follow-up will pull up, and they all basically look the same. They follow the same pattern. The reason they're clinical note templates is so that we can include the pick lists. And again, this is to help guide the follow-up, making sure that all the pieces of the follow-up are completed, but also that the provider doing it knows exactly what you're following up on. So here's the 1-week follow-up appointment clinical note template. You want to ensure that you've reviewed any outstanding lab results, and you have your pick list here of all the ones that you've been able to review. For your HIV follow-up, we need to ensure that the 4-week follow-up appointment has been booked. For repeat LFTs, if they've been started, or if they haven't been started, there's no follow-up required. Similarly, 12-week follow-up, that the appointment was booked or no further follow-up required as per the guidelines, and the medication either was required, was prescribed but not filled, and then the discussion that accompanies that. Hepatitis follow-up will be dependent on which of those pathways that was followed at the time of the initial visit, whether they require a second dose of HBIG, whether they require an additional vaccination, whatever the presentation warrants. And again, the link to the protocols are here that direct to even the specific page that this is housed in order to make it as easy as possible to find the references you need in order to guide what steps have to be taken. The bottom of the clinical note template is where we've automatically pulled in the dates that had been populated. So because we didn't generate the form, not all of them are here, but we're saying these are the follow-up that has been arranged and will be arranged as part of your discharge plan.
For both the urgent care and emergency departments, an initial assessment of blood and body fluid worksheet and discharge summary documents will be entering the documents queue. Upon receiving these documents, set the type to Healthcare Reports and select the subfolder as Post-Exposure Prophylaxis, PEP. The created date shall be the date the document was actually created, and the received date should be the date that it was received into the clinic. Take out the reviewed date, as the provider will be the one reviewing the document, and select the generic walking connected care provider or continue to follow the site process to date. Then select Send to Providers. Within 24 hours of receiving the referral, contact with the patient and an appointment must occur. Within the scheduler, select the provider and date to book. Right-click on the appointment time and select Create Appointment. Set the appointment type to long visit and set the reason to trauma if a primary care site, or reproductive health for walking connected care clinics. Set the duration of the appointment to 1 hour and select OK to book the visit. Contact with the patient to book an appointment must be attempted no less than 3 times. In situations where the patient does not present for the scheduled appointment, right-click on the appointment and select No-Show. An NS will appear on the appointment. Then the PCA shall contact the patient to check if they would like to rebook. Again, the PCA should attempt contact 3 times. If no contact is made, a letter will be generated and sent to the patient. The PCA will then document the steps followed within the patient section under the Notes tab. Select Add Note to add your note to the list. In situations where the patient presents for the appointment, the PCA shall right-click on the visit and select Arrived. The appointment provider shall initiate and complete the follow-up assessment of blood or body fluid exposure form. Within the EMR section, select the Encounter Notes tab at the top and select the arrow over to the right-hand side. This will open up the drop box. From here at the bottom, we can search for post-exposure and select the follow-up assessment of blood or body fluid exposure. The form will present. The provider fills in the form as necessary and selects OK to save to the chart. The PCA will book the follow-up appointments and print out a copy of the upcoming visits. To print a copy of the patient's upcoming visits, select F4 on the keyboard. To initiate the consent form, select the EMR tab and Encounter Notes at the top. Select the drop-down arrow, and in the search section, search for consent. Select the post-exposure prophylaxis verbal source consent clinical note template. Upon selecting, the clinical note template will open. Notice there are two different sections within the consent form. Section 1 is the source education discussion script. Section 2 is the actual consent. Notice how the pick list appears for the section number 2. To utilize the pick list, single clicking will keep all options within that selection. To then keep these options and remove all others, select the pencil icon in the upper right-hand corner. This will keep all highlighted sections and remove all other options. Users also have the ability to double-click on the option, which will then remove all other options within that section. To save the consent to the chart, select Save and OK. A quick patient appointment window will appear. Select File in the top left-hand corner and select Print Patient Schedule. From here, select the checkbox for Include Future Appointments. Then select Print. Ensure the correct printer appears and select OK. Upon the patient arriving for their follow-up appointment, PCA shall right-click on the visit and select Arrive. The provider shall then initiate and complete the post-exposure prophylaxis community follow-up clinical note for the pertinent visit. Within the EMR tab again, select Encounter Notes at the top, select the drop-down arrow, and in the bottom, search for post-exposure. Select the clinical note template which applies. For example, 1-week follow-up, 4-week follow-up, 12-week follow-up, 24-week follow-up. The clinical note template will take approximately 40 seconds to open up due to the tags that are pulling for reporting purposes. Once the clinical note template appears, select all of the information that applies. For example, for reviewed outstanding baseline lab results, select all of the options which apply. Selecting the options once will highlight them in yellow. Double-clicking will keep whichever options were selected and remove everything else. To view the hyperlinks included in the clinical note template, hold Control down on the keyboard and click on the link. This will open up the appendix within a browser window. Once completed, select Save and OK to save to the chart. I hope you have found this module on the post-exposure prophylaxis Akiro EMR workflow helpful. For further questions or clarifications, please contact CSIS_support at sharedhealthmb.ca.